Welcome to this comprehensive video on gallbladder stones. In this guide, we'll discuss the symptoms, causes, risk factors, and complications of gallstones. We'll also delve into the methods of diagnosis, surgical treatments, post-surgery care, and ways to prevent gallstones. Whether you or a loved one is dealing with gallstones, this video aims to answer all your questions in detail. What is the gallbladder? The gallbladder is a small, pear-shaped organ located under your liver. It plays a vital role in digestion by storing bile, a digestive fluid made in the liver. Bile helps break down fats in the foods we eat. When the bile contains too much cholesterol, bile salts, or bilirubin, it can lead to the formation of gallstones, which can cause various health issues. Symptoms of gallstones. While some gallstones are asymptomatic, many cause noticeable symptoms. Severe pain in the upper right abdomen or the middle of the stomach, often radiating to the back or shoulder. Episodes of nausea and vomiting, especially after fatty meals. Persistent bloating, indigestion, or discomfort in the abdomen. Yellowing of the skin and eyes, known as jaundice, if a bile duct is blocked. These symptoms are often referred to as a gallbladder attack or biliary colic. Causes of gallstones. Gallstones form when the components of bile become imbalanced. Common causes include excess cholesterol in the bile, which may crystallize into stones. Poor emptying of the gallbladder, leaving bile stagnant. High levels of bilirubin, often linked to liver diseases or infections. Being overweight or experiencing rapid weight loss, which alters bile composition. Risk factors for gallstones. Several factors increase the risk of gallstones, such as gender. Women, particularly those over 40, are more prone to gallstones due to hormonal changes. Obesity, excess weight increases cholesterol levels in bile. Family history, a genetic predisposition can play a role. Certain medical conditions, diabetes, liver disease, and metabolic syndrome elevate risk. Lifestyle factors, poor diet, low fiber intake, and physical inactivity can contribute. Types of gallstones. There are three main types of gallstones: cholesterol stones, yellowish and primarily made of cholesterol. These are the most common. Pigment stones, dark brown or black stones formed from excess bilirubin. Mixed stones, a combination of cholesterol and bilirubin stones. Diagnosing gallstones. Gallstones are usually detected during imaging studies for abdominal pain. The diagnostic process may involve ultrasound, the most common and non-invasive method for identifying stones. CT scan provides detailed images of the abdominal area to assess complications. MRCP, magnetic resonance cholangiopancreatography, helps visualize bile ducts for blockages. Blood tests identify signs of infection, jaundice, or other complications. Complications of gallstones. If untreated, gallstones can lead to severe complications, cholecystitis, inflammation of the gallbladder, often requiring emergency treatment. Blocked bile ducts, causing jaundice, severe infections, or pancreatitis. Gallbladder rupture, a rare but life-threatening condition. Increased cancer risk. Long-standing gallstones can slightly increase the risk of gallbladder cancer. When is surgery necessary? Surgery is typically recommended in these cases: persistent and severe symptoms that disrupt daily life. Repeated gallbladder attacks or inflammation. Large stones or stones causing obstruction of bile flow. High-risk individuals, such as those with diabetes or compromised immunity. Surgical methods overview. Two primary methods are used to remove the gallbladder or stones: laparoscopic surgery, a minimally invasive procedure using small incisions and a camera to guide the surgeon. Recovery is usually quick. Open surgery involves a larger incision and is reserved for complex or emergency cases. Steps of laparoscopic surgery. The surgeon makes small incisions in the abdomen. A laparoscope, camera, and surgical tools are inserted. The gallbladder is detached from surrounding tissues and removed through one of the incisions. Incisions are closed, and recovery typically begins within hours. Steps of open surgery. A large incision is made in the upper abdomen for better access. the gallbladder is carefully removed, ensuring no damage to nearby organs. The incision is stitched, and recovery takes several weeks. Post-surgical procedures. In cases where stones remain in bile ducts after surgery, an endoscopic procedure, called MRCP, is performed to extract them. This is done using a flexible tube inserted through the mouth into the digestive system. Potential post-surgery issues. After gallbladder removal, some patients experience diarrhea or loose stools due to the constant flow of bile into the intestines. Difficulty digesting fats, temporary discomfort after fatty meals. Rarely, infections or bile leakage may occur, requiring medical attention. Dietary advice. Before surgery, avoid fatty or fried foods and eat smaller, more frequent meals. After surgery, start with light, low-fat meals and gradually return to a regular diet. Include more fiber, lean proteins, whole grains, and healthy fats in your diet. Lifestyle modifications. Prevent gallstones by maintaining a stable and healthy weight. Eating a balanced diet rich in fruits, vegetables, and whole grains. Staying hydrated and avoiding prolonged fasting or crash diets. Exercising regularly to promote overall digestive health. Preventing gallstones. To lower the risk of developing gallstones, drink plenty of water to aid digestion. Limit cholesterol-heavy and sugary foods. Opt for small, frequent meals to keep bile flow regular. Conclusion. Gallstones can be managed effectively with early diagnosis, proper treatment, and lifestyle changes. Surgery is a safe and proven solution for symptomatic gallstones, while preventive measures can reduce the likelihood of recurrence. If you have symptoms or concerns, consult a healthcare professional for personalized advice. To watch more health-related videos, please like, share, and subscribe.